I'm not even.
That's the gist I'm getting. She's a more natural. person.
Ready? All right, at this time, I'd like to call the Wednesday, August 19th, 2026 Board of Health meeting to order. Jenny, would you call roll for us, please?
Here.
Present.
Here,
Here.
here.
Thank you. We have a quorum. Next item on the agenda is the adoption of the agenda. So hopefully everybody's had a chance to take a quick look at the agenda and entertain a motion to approve or
I move to adopt the agenda.
I will second.
motion and second. Any further discussion on the agenda? Hearing none, all those in favor, please say aye. Opposed, say nay. Motion carries. Next item on the agenda, the approval of the minutes from our July 15th, 2026 board meeting. Hopefully everybody's had a chance to review those. Discussion or entertain a motion.
I make a motion to approve the minutes.
Second.
We have a motion and a second. Any further discussion or do we need more time on the minutes? Hearing none. All those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Next item on the agenda is board president announcements. I have no announcements again today, so. Next item, health officer's presentation and report. Item 2645, discussion and vote. Health officer's report for July. Dr. Migliori.
Hopefully everyone had an opportunity to peruse the health officer's report. I just wanted to touch upon a few things that were not in the report, but are ongoing. We're currently in the hiring process, interviewing candidates. We have a position in foods, a position in a part-time immunization nurse position, a community health worker position in maternal infant health. We have a position in as a health promotion specialist, and we have a position open for data analyst. And we've had, I think, over 275 applications for the data analyst as of today. So for our HFI positions, we have to keep those positions posted for 30 days. So sometimes it seems like things get strung out because of job openings, but we're interviewing and we actually are ready to make offers to probably at least 3 of the 5 positions right now. So we're very optimistic, and it's a lot to go through 275 applications.
Wow.
So it's a good thing. Then I know also that in the news recently was about our mosquito spraying, and I just wanted to address that briefly and let you know that we have really, this is our first year with our new vector person, our first summer of treating mosquitoes. And she's been doing a great, fantastic job. She's primarily focusing on larviciding as recommended by the state entomologist. So that is our only really great natural option. It's the most ecologically friendly option. And so it's 2 strains of Bacillus thuringiensis and Sapphiricus. And we're also using a organic agent, spinosode. And so those are ones that we try to get, and mosquitoes hatch every week. And so she's out there every week. And as I mentioned to the council when we did our board budget presentation last month during the tornado, that Leela put over 500 miles on the truck last month. So she was really, and that was mostly larviciding, just trying to find that standing water. This year we have sprayed, I believe, 2 or 3 times total. In the past, we use pyrethroids for our spraying, but there is documented resistance to that particular agent when you use it year after year, and we've used it several years in a row. There's a couple of big counties in the United States like Chicago and Dade County, Florida, that actually their fully resistant to that particular agent. We do not want to become resistant. And so the recommendation of our state entomologist, Lee Green, and the people who sell any of the chemicals that we use, they strongly recommended that we go with an organophosphate this year, the chlorpyrifos. And that is at high doses, at really highly concentrated doses. It can be a neurotoxin, but we don't use it at high. We use very, very tiny amounts. A shot glass full would treat a football field. And so we try to take all precautions we can to notify people. There's a system of email. People can register online through the health department to get email notification for out in their area spraying within the next 24 hours. We also do press releases. We understand that people are concerned, but again, it's a legal agent. We use it very rarely and very sparingly. Like I said, we've only used it a couple times. We have very strict criteria. I know that Leela is very conscientious, and she stays 1,000 or 100 feet away from the river because she wants to protect the aquatic life, the fish, the macroinvertebrates. She worries about the pollinators. So the pollinators luckily sleep at the same time we sleep. So she always sprays between 10 p.m. and 2 a.m. So she's really literally working the night shift this month. But she is very conscientious. She took toxicology in grad school and is very familiar with the chemicals. We also have the criteria that we need to have 2 positive pools that are new in order to spray. So it's and that's sort of a national standard. And it's a very, we put a lot of thought and a lot of, really passion towards doing the right thing. But West Nile virus is on the increase. This year, hospitalizations are up by 67% for severe disease. So it's just something that we have to be aware of. It's not anything that we want to cause chaos or breed havoc, but we just want to make sure that people understand that we're doing this very thoughtfully and very carefully and respectfully as well. But people are always encouraged to call the health department if they have questions or concerns. We do want to be transparent. We will let you know when we're spraying, but we haven't sprayed that much because we haven't met the criteria, the threshold for spraying. And a positive pool is considered 1 positive mosquito out of 2,000 tested.
1 positive for West Nile.
Yes, sorry, West Nile virus, yeah.
And the process of spraying, that's all, there's guidance we're following from the state or the federal?
From state and the state level with Lee Green, the entomologist, and also he was the state entomologist for Indiana Department of Health, and also the chemical company that sells us all of our agents. So it's not like they're financially driven to try and direct us to one chemical over another. And they know about the concern, they're well aware. But again, we are very, very conscientious about this.
Is it safe to presume that if the department's focusing on using larvicide and not spraying as much, that will also avoid building up resistance in the mosquitoes to a particular spray?
Correct.
So if we're switching over to focusing more on larvicide, then when you do have to spray kind of going forward, you might be able to just go with a less toxic.
The
spray.
pyrethrin, yeah,
Okay,
that's what we
So-
plan to do.
okay. So hopefully focusing on the larvicide will be another tool for creating mosquito resistant
Yes, and
populations.
we also have this
Mosquitoes, disease, you know what I'm saying?
we're also using the GPS to track. Leela's able to record every place that she drops larvicide and know the results of those pools. All of that is on a computer attached, an iPad attached to the sprayer. So it's GPS marked. If there's a certified organic farm, then we don't, spray there. But it's very technical, but this was a building year so that we could have all that information. It wasn't collected or available before.
You said, I'm sorry. Go ahead. You said that West Nile virus cases were up 67%. Is that nationally or locally?
It's nationally.
Okay.
Yeah. Seems like all of the vectors, like tick disease is up on both coasts. You're seeing more Lyme disease, and every region sort of has its own version of tick diseases. I know California has 3 unique tick-borne diseases. They're seeing an uptick in West Nile too. It's not just a local phenomena. It's nationwide.
Do we have educational material or statement that we give to the public that says, these are the things you can do, these are the things you can spray or use as larvicides? Like that's.
Yes, and we are, and we're putting it on social media, and we're trying to let people know, don't let the standing water, the usual things, don't go out if you don't have to go out after sunset, because they're lighting more at night anyway, or when it's cooler out. It's not in the heat of the day when it's sunny that they're usually out. So early morning, late at night, not have the standing water. And you'll notice in Leela's report, vector report, she talked about passing out some, it's like swag. It's some of the discs that she uses, the organic material, for people who request it, and they can put it in their own standing water that they can't get rid of.
Okay, great. Anything else from your report?
No, people are really, really busy. It's a busy time. Environmental is busy with septic, massage. They're just booming everywhere. Lead, and immunization. This is the time people are getting their kids immunized before school starts. Beginning of the school year, when school nurses are like, hey, you need this updated. We're doing mobile immunization clinics. They're working on the weekends. So the team has really been working hard. We also got the poor public health nurses. They got hit with the cryptosporidia. People were calling and wanting information about that and wanting to know what was going to give it to them and what they should avoid. And a lot of people were afraid and wanting to get the state to get it, their stools tested, which is a very expensive test, and the state wasn't doing it anyway. But just a lot of that. We also got hit with some salmonella at the same time. So the poor and tons of animal bites, as you see in the report. But the public health nurses have just been burning the candle at both ends. And foods, if you guys go to ArtB, if you go to the 4-H fair, coming up next will be September events, but also Notre Dame football. So they are beating the streets too. God bless them all, because they're keeping very, very busy.
Sure. Thank you all out there for your hard work. Any other questions for Dr. Migliori before we go on to our spotlight?
The cyclo,
Sporidia. Mhm.
okay, the diarrhea. Is that going, what is it locally? I guess I saw a news article that just said that there are a lot of cases up in Michigan. You don't know where in Michigan. I mean, at least it didn't.
Yes,
But
over 4,000 cases.
yeah, but what about specifically around here?
I
is
think
it-
that the last time I looked, it was like in the 70s, but
Okay.
it's going down. I
Okay.
mean, nationwide, it's trending down.
Okay, because it's from certain food processors that had,
Yeah, it
County.
looks like it was probably from some produce, not just the iceberg lettuce, but some
Yeah.
produce. It's so hard to track it down because you may not get symptoms for 2 weeks. Well, who
Mhm.
knows what you ate 2 weeks? If I asked you, what did you have 2 weeks ago today? It's like, I don't remember, So it's very hard to track down.
Okay.
But the incidence is going down. The only thing that's ticking up nationwide right now is measles, which is concerning. We had a local case that we're testing now, so just something to be aware of. And it's a very contagious thing. You have a 90% chance of contracting it if you're exposed to it and you're either under immunized or, you're somehow immunologically compromised.
Okay. Any other questions for Dr. Migliori? We move on to the spotlight.
That would be great. And Brianna McCall is our Director for Environmental. And she's going to cover all things environmental except Vector. Vector has their own spotlight in October. So
Okay.
I just covered it because it was in the news.
Yep.
Hello.
Hello.
All right, so I'm just going to talk about a handful of our programs today. Like Dr. Migliori said, Vector gets its own unit spotlight, I believe, in October. Radon gets one in December, and I feel like lead somehow creeps its way into almost every unit spotlight. So I'm going to let lead have its moment another day. But so this is just a list of all the programs. There's a few small ones that I didn't list here, like solid waste and air quality, which would be burn permits. But otherwise, we have our septic program, healthy homes, radon, massage and tattoo, and body piercing, water, Vector, lead, and property transfers. Besides Radon and Vector, which are both funded through HFI, all of our other programs are either state mandated or have a county ordinance. Some of them have both. So most of the work that we do is required. It is not often fun and glamorous, but it is important work that does help protect the public's health. You can go to the next slide. I can't really talk about all of our programs or the successes of my team without mentioning our admin staff. So these two truly do everything. Everything begins and ends with them. They juggle a lot in the average day. They have to answer all the phone calls, which there are plenty of phone calls. They handle the shared email. They deal with everyone that comes into the front counter. I'm also going to take a moment to highlight foods admin staff because our admin staff and them work very closely together. So it's really awesome to see two units kind of help each other and lean on each other when they need it. But I don't know, they keep me sane. So I really appreciate these two and I wanted to highlight them. Everything.
Can
Sorry.
you remind me of their names?
Yes. So Melanie's here on the left and Josie's here on the right. So Melanie's our admin assistant and then Josie is staff assistant. But yeah, so they kind of begin and end all of our permitting and licensing. So year to date, they've actually helped process over 750 permits and licenses, which is a lot for two people to do, but they're very good. They're very organized, very good at communicating, and they do a really good job. They also they receive and process all of our complaints, and we definitely get a lot of complaints. So anything from, my neighbor has effluent on the surface to my neighbor is scraping paint off the side of their house and it's clearly an old house. I'm concerned there's lead. They screen all of those. And so they do a really good job of handling people that are either angry or frustrated or sad or scared. So they do a really good job with that. And I'm just in awe of the compassion that they show to people. Again, we do receive quite a few angry phone calls and emails and people that come to the front counter, but they handle all of it with a lot of grace and compassion. And even Josie here on the right, last week, she was helping somebody at the front counter. They were trying to do a change of use. So a lot of septic questions. And she did a great job explaining the whole process to him. And he left. 10 minutes later, he came back and was like, do you want a different job? He was like, you did such a good job of explaining this. He's like, you were so helpful. And he's just showering her with compliments. And I kind of felt like a bitter, jealous boyfriend. I was like, okay, it's probably a good sign when your staff is being scouted right in front of you. But luckily, she also denied him. So we're very thankful for that. But all in all, they keep our heads on our shoulders. And I really couldn't talk about everything else we do without mentioning them. You can go to the next slide. All right. So big changes coming up in the world of septic. So as you're probably familiar, the state rule is going to change. It's been shifted a bit. I believe statutorily they were supposed to have it done by July 1st, but there's been a lot of revisions from public comments throughout the entire state of Indiana. So that's been getting pushed back just so they can make sure that it is approved as needed. So we're anticipating that state rule change. I'm just not sure exactly the date, and I don't think they have a permanent date set. But whenever that does change, we'll have to obviously change our county code to reflect their state rule change. We're currently in like the review process. So we're reviewing what we currently have as an ordinance, getting rid of the stuff that obviously will need to change, and just trying to prepare ourselves so that when this state rule does go in effect, it doesn't take too long for us to get our ordinance revised. So right now we're in like the early stages of revisions for that rule.
Can you tell us just what the major changes substantively will be?
So the biggest one is that currently there's 4 definitions of failure for a septic system. They're adding a 5th one to be the presence of a dry well period. So currently, if you have a dry well and it's in failure, then that would mean you'd have to get a replacement. But the state's changing it so that just a dry well, whether it's functioning or not, has to be replaced. So that's the biggest change that we anticipate. And this conversation's been happening for a very long time. So even though it's a huge change and we anticipate a lot of problems there, I think between contractors, inspectors, and local health departments, we've kind of known about it for long enough that we have an idea of what that will look like. Certainly going to be challenging, but that's the biggest one. Yeah.
Is that like, we're gonna go look up all the dry wells in our area and
Nope.
tell people?
Nope, it's just, again, if they were currently trying to do a repair permit, but we see there's a dry well and it's functioning, there's not much we can require. Like a lot of properties will have, you know, maybe the washer and dryer discharges to a dry well, but everything else goes to a septic system. They would have, if that dry well is working or not, they can't have it anymore. So that's the biggest change.
And is the dry well what people like campgrounds put in? Is
Um,
what are those?
Maybe
called?
very, very old campgrounds, like decades old, but
That's not the same as a holding tank. That's what.
No.
no. But yeah, so that's something that you guys can anticipate that will be coming to you, because we will obviously need your guys' approval of our county ordinance at some point in time. But again, right now we're kind of in the early phase of that. But luckily the state has been pretty communicative about revisions and public comments and whatnot, and we've submitted plenty of our comments. So
What is the county ordinance we're on right now?
So it's County Code 51, but we don't technically utilize County Code 51. So the TRP has to approve of whatever ordinance you're using. And there was a weird period of time where it hadn't been approved, and they basically said that anyone that had been approved before a certain date was considered void. They don't oversee like inspectors, contractors, or the fines and fees. So all that stuff we're able to utilize still, but as far as the rest of it, if we send like an abatement order or something, we don't use our code. We just use the state's rule. So it's
But we're
County
gonna
Code
make one.
51.
You're saying we're gonna go back and make one still?
We'll have to use the same one, just revise it to make sure it's in line with the state's rule.
You want to name your crew?
Yeah. So this is our crew here. This is Katie, Rebecca, and David. So they handle quite a bit. We understand that people don't oftentimes love to get a septic permit. It can be really challenging, but they do a really good job of navigating that. So far this year, we've issued 239 permits, performed 437 inspections, and done 11 consultations. So again, a lot of work for 3 people to do, but they do a very good job. And we know that these can be complicated, but we're really proud of our turnaround time. So we've actually gotten it down to where in June and July, which are our busiest months, we actually only took 4 days to issue specs and an average of 9 days to get a permit issued. So we're pretty proud of that. Just kind of shows that we're able to help the public. Granted, we're always going to have outliers. There will always be cases that are complicated and take a bit more time, but on average, we're getting them out pretty quick. So really proud of that. Earlier this year, we actually launched a new system for schematic requests. And we, again, in just June and July, busiest time of year, had fulfilled 530 requests. So that's a lot, and it's not something that we have to do. It's like a courtesy to the public, because again, let's say you're a homeowner and you want to put in a pool or something, you don't know where your septic system is, you can request a schematic and it'll show where your septic's at. Or if you are trying to sell your property or something and you just want a drawing of it, that's something we offer. Usually inspectors or contractors that want those, but you can go to the next slide. And so we wanted to make sure that all the changes that we're making are helpful to the people that we serve. So we had sent out a feedback survey, and these are just a few of the responses we got. All the responses were very positive. I'm really proud to say that not one of them was negative. And overall, people are just pleased that things are faster. Okay, you can go next one.
Are we charging for that? Is that a?
No,
No?
no,
Oh,
there's a county in Michigan I can't think of that charges like $8 for one. But we feel like it would be in poor taste to charge people for this because one, we charge for the permits and this and that and the other thing. A lot of times, again, when people want a schematic, it's because they're getting a permit or something else. And
Mhm.
so it's kind of just something that we can give. And then we're also in talks with developing something to where people can just log on to a site and pull it themselves. That way it kind of takes us out of it. We're thinking maybe that would be something that people pay for because it removes work on our end and it makes it easier for the public. So that's something that we would like to do, but it's not something we've started developing quite yet.
Okay.
So right now is the process, they submit a request online and then you
Mhm.
have to look it up and send it to them?
Yep, we basically just like drag it over and they get a notification. We don't even send anything out. They get an automatic notification if it's there. We don't always have every schematic on file because sometimes, I mean, you'd be surprised how old some of these systems can last. And so we don't always have something if we weren't keeping files in, 1951 very well or whatever. But yeah, so right now they just submit a request and we get it out pretty quickly, usually the same day, if not the next day.
I feel like you could charge. I don't know why that wouldn't be a thing because you're doing the work. So
Yeah, I think we're trying to be considerate because in a lot of ways for septic, in the septic world, we're not well loved as a local health department. I think most local health departments will acknowledge that they're, they make the process a little bit more difficult. So this is kind of our way of being helpful. But again, our hope is that we can develop a system that people could pay for if they wanted to, or they could just pull it themselves. But that's, again, way down the road. That's nothing we can do tomorrow. But if we wanted to charge, that's what we
yeah,
can
if they
do.
weren't getting, I guess if they weren't getting a permit, if they
Mhm.
weren't utilizing you in another way where you were in their
Yeah.
file anyway.
And I will say, if people come to the front counter and they want a physical copy of it, then they do get charged. It's like, I don't know, a dime or something like that. But we're getting that paper money
Printing
back.
costs.
Yeah.
Yeah, but it's time.
Yeah.
It's your time.
But we're just trying to be helpful because we know the process is not super fun. So, but okay, next I'll highlight our Healthy Homes program. So this is one area where it can oftentimes be intense and sometimes even a little sad. But again, everyone on my team does a really good job of handling complaints and inspections with a lot of grace and care and empathy. Oftentimes we're investigating a situation where someone's called in and said, my neighbor doesn't have water service and I saw them dumping their feces in the backyard. Or my neighbor has 3 RVs parked in the house, in the driveway, and they're all using the bathroom outside. What we're concerned with is in the same way that if a septic system fails and there's effluent on the surface, that if you don't have water service, then there's effluent or feces somewhere. So that's probably the most common Healthy Homes complaint we get. As you can see in the photo on the left, that's an RV where they did not have water service. And so they were using the restroom outside. We did collaborate with code enforcement on that one because of the amount of garbage that's outside. We don't get involved with garbage unless we know that there's human waste, food waste, or animal waste. So if there's used adult diapers, if there's scrapped food, if there's animal carcasses, things like that, then we would get involved. But if it's just junk like there was here, that was a code enforcement thing. We collaborate with them very frequently. Same with bottom right, that is the shininess you see on the ground is actually human waste there. So obviously that is a public health threat. So we do, in some situations, condemn the home, declare it unfit, in which case they are not able to live there until the conditions have improved. So again, this is oftentimes due to a mental health or a financial issue. So our staff does a good job of connecting folks with resources. If they fall within the City of South Bend limits, City of South Bend has many very good grants and programs to coordinate with. But this can get sad sometimes. But again, we do a pretty good job, I'd say, of helping, because sometimes it feels like we're not helping. At least that's how they see it when you condemn a home, but we do give them the appropriate resources. Next slide. So the last program that I'm going to highlight is our massage program. What a year that was this year for massage. So year to date, we've completed 127 inspections between 75 establishments, which probably doesn't seem like anything too crazy, but that is insane because there are only 75 establishments. So in theory, we should only be doing 75 inspections, because in an ideal world, they would all have their annual inspection and that would be it. We wouldn't get any complaints. We wouldn't see enough violations that we'd have to return. But unfortunately, 52 of those were follow-ups or complaints. So that's quite a bit of inspections. A reason we would need to go for a complaint would be someone saying, I know that this place has someone and they're not licensed. So you obviously have to have a license in our county. Not every county in Indiana has that, but our county does require that not only do you have the state certification, but that you also have our county license. So in the event that sometimes they don't have either state or county license, but for us, you need to have both. We also get many complaints that people are living in the establishments. Can't do that. And as you can see on the photo on the left, that could be the next room over from where someone's getting a massage and they're clearly living there. And if that's a break room, it's a pretty comfortable one. Well, I wouldn't say that actually. Let me back that up. But another complaint we would get would be improper cleaning. So you'd be surprised how many we have to instruct on proper cleaning methods. Again, that's all spelled out for them. But some people are just replacing sheets on the massage beds, and we have to instruct them on how to wipe down the beds in between services. Some of them, we ask them to show the cleaning products. They might not have any. So we do have to thoroughly instruct people on how to clean the massage establishments. As you know, we had just updated our ordinance. And so we're looking at, for next year, we anticipate that after this year, the establishments will be more familiar with what is required of them. And that we hope that in 2027, we don't have to do 127 inspections, but we'll see how that goes. We're just currently planning out and trying to map out how to be better prepared for that. You can go next slide. But yeah, that's my team. I think that everyone's done a really good job this year and every year that they've been here. But as this has been my first almost full year now as being director, I'm really proud of all the improvements we've made, but also all the things that we want to do differently still. So do you have any questions?
Thank you very much. Any questions for anybody? No, I think you ought to keep on those inspections at the massage parlors, like maybe every quarter,
Yeah.
especially if they need help cleaning things. But
Yeah.
that's just me.
Yeah.
I'll leave that up to you guys.
I guess I'm surprised at the ratio of, not your regular inspections, but I mean, I'm assuming a few of those are multiple.
Yeah, so
inspections.
I wouldn't say that the bulk of them need a follow-up or a complaint. It's a handful. And we did have to shut down quite a few this year, in which case they won't need follow-up inspections. But we've also had to kind of ensure that places are closed. So that's a whole nother conversation we could have when we're not here.
All right.
There are still a subset of massage parlors that are following the rules.
Absolutely.
that
I
are
would say the
clean, that
majority are
sanitary.
upstanding. And I mean, I can't even compliment enough the ones that do good work. That, when we changed the ordinance, I think that there were 3 categories of people where they were either very, very happy. They were either mad because it felt like more work for them, or they were mad because they knew it affected them. And so for those that maybe felt like, I do a good job, why are you making it harder for us? In talking with them over time, I think they start to realize that the work they do is exceptional and it does deserve to be held to a high standard. So I think that the majority do a good job and have learned that we're not against them in any way. But
All right. Well, thank you very much for all your efforts. and
Thank you.
for Your leadership, and thank your staff as well for us. All right, next item on the agenda or I'm sorry, we have to vote on this item first. So item 2645, the health officer's report. Can I get a motion to approve?
I make a motion to approve item 2645.
I'll second it.
A motion and a second. Any further discussion? Comment? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next, section on the agenda, new business. First item, 2646, discussion and vote on, job descriptions for administrative assistant for environmental health, staff assistant for environmental health, and immunization registrar for nursing. Mike.
Hi, good evening. Mike Rowell, Director of Operations. Before you, you have three of the latest job descriptions. And we're nearly at the end. I'm happy to report. Probably just a couple more months and we'll be finished. Which will be reason to celebrate. But in the meantime, for these three, as in with the previous months, these have been standardized. We have updated them where they needed updated. But there are no major changes. The job descriptions already were describing the duties for the most part. We just fine-tuned them and brought them into the modern age, so to speak. And so I just ask for your support on approving these, and I'm happy to take any questions that you may have.
Thank you. Dr. Migliore, I assume you're
Yes.
supporting these, and the board, I'm sure, has had a
Yeah.
chance to look at them and
The finished copy and they look good. I do appreciate, I think it was a little tricky with the immunization registrar for nursing is that this is not a medical position. So the terminology, I think, cause I looked, I was asking like, okay, are you saying the terms correctly? Cause we don't want to imply that this position is actually engaging in
Clinical practice.
clinical work, yes. But there's some things, especially with the way things were worded, some things, especially with registering people for immunizations and things, where it was like, she's clearly it's the staff position that she's really like following the guidelines that are set out, that isn't making an independent clinical judgment. That is clinical stuff. So I thank you for making that clear, which I think you did when I read it the last time. So.
Well, thank you for your feedback. It was very helpful. And we did want to make sure, especially with that one, that this particular position does work under the direction of clinical staff, namely the registered nurses.
well, thank you. Any other questions or comments? If not, I'll entertain a motion to approve these job descriptions.
I make a motion to approve item 2646.
Second.
Motion and second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries.
Thank you.
Thank you. Next item, 2647, discussion and vote, schedule of fees and fines, nursing.
Hello.
Hello.
We did our quarterly review of the vaccine fees through our third-party vaccine company that we use, VaxCare, and then the ones we also order on our own. And we do request some changes be made. We have some fees increasing, 3 of them. One for COVID ages 5 to 11 years, COVID 6 months to 11 years, and then meningococcal MCV4. We also have some fees decreasing, 6 of them. COVID 12 years and up, influenza high dose, PCV 20, which is the pneumococcal vaccine, rabies vaccine, RSV for infants specifically, and oral typhoid. We also have 3 vaccines on the schedule that we just don't administer anymore, so we would just like those completely removed so customers don't ask for those vaccines and we don't carry those.
Thank you. Does this have to go to council next? And also, maybe for you, Dr. Migliore, why do you suppose the COVID 5 to 11 is $71 versus the other 2 are both 121? Any weirdness there? Don't know.
I do not know.
Oh.
Do you know?
Those are from
I would ask the
VaxCare.
manufacturers.
So just to be clear, the you have $2 amounts. So the first one is what we are
Proposing
proposing, and the one in the
parentheses is the current schedule,
Oh, okay.
the current fee schedule
Okay.
price.
Okay. And I was just thinking how to put this. So we have the department has a formula for how much you're going to charge for vaccine. Vaccine cost plus service fee. And so the changes are really just, the formula stays the same. It's just as the costs from the manufacturer change, we are just pushing that forward.
That is correct. These are changes made by VaxCare,
Mhm.
by Sanofi Pasteur, and then also by Medical Mart. Those are the three places that we get our vaccines from. So VaxCare puts out a quarterly review of fees. So if we have a patient paying at the counter, that is when this fee schedule would come into play. That is what they would be paying at the counter. So we're just trying to recoup what VaxCare is charging us for the vaccine.
Okay, but it's, because I know, frequently we get these revisions, and it's really just, it's not like anybody's,
It's a pass-through.
yes. So we're just
And in
using
the
the
pa-
same formula and then adjusting accordingly.
And in the past, we had a thicker cushion, and that's why we didn't have to come as often. And it was decided to minimize what the percentages that we add on top of the vaccine, on top of our admin fee. So that's why we do have to come to you a little more frequently than we had in the past.
Okay.
But it is directly related to the cost that we are paying for the vaccine.
Any other questions or comments? Hearing none, or I will entertain a motion.
I make a motion to approve item 2647.
Second.
We have a motion and a second. Any further discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next section on the agenda, grant requests. First item, 2648, discussion and vote to apply for Indiana Department of Health vaccine.
Yes, you got it. Renata Williams, Director of Care. We are seeking approval to apply for the naloxone grant. This is a grant that we applied for last year, and I think the year before that, to continue receiving our doses. These are the doses of Narcan that we use to stock the public access boxes that we have all throughout the county, which is 30. And then in addition to that, during the trainings, and we also supply a lot of the first responders, the schools. So like I've had a school call and ask to pick up 40, 50 doses so that they can stock all of their first aid kits. I had another rural fire department call to say if they can pick up some more doses to stock their trucks. So this is what we use to supply. And we are almost out. And before we can order any more, we have to apply for the next year.
I forget, is this is just the annual grant that we've been, so we get, and we can get up to what?
6,000.
And how many have we asked for?
We are about at the 6,000. I think
Oh,
we
wow.
probably have about 400 and something left. The thing is, stocking the boxes takes a great deal of it, but when people know that you have that available, like the other organizations in the schools and other people, then they start asking and picking them up so that they can have it too. And then we have to also take inventory and supply our boxes. And so also when we have the public classes and we're teaching and talking about it, they do give them a dose to take if they want to. When we do our events, when we're talking about overdoses and naloxone, people are able to take a dose too there if they would like.
I'm just curious, in the boxes, do they ever expire? Like, is there
They
a
do.
point? Oh,
So
okay.
that's another thing when the town called, she said that some of them had expired because so
Okay.
they needed some more. Yeah,
Any idea how many of those actually get used?
I do not, because it just depends. Sometimes they have them, just in case, like an emergency. And sometimes they do have them and they are using it. And sometimes in the event of an overdose, you might have to use more than one. So.
And the health department, we are the principal supplier for the county. Is that
Yeah, from my
program?
understanding, for the most part, because of this grant with IDOH, who gets the doses, this is in conjunction with Overdose Lifeline, who actually supplies the doses as the manufacturer. As a health department, we do get the opportunity to get a lot more. So other organizations that maybe work in harm reduction can get Narcan, but they're not gonna have as much supply as we can, because then we take it, of course, and then disperse it into the community.
Because you're the go-to source for the schools and for police departments, fire
Yeah.
departments.
Yeah. Yeah, they have a section where it breaks down like who you're giving it to. And if it's like first responder, if it's a school, if it's a lay person, police officer, whatever.
Okay, thank you.
Is the health department actually who is tracking that metric to see if that's improving in our area? Meaning just.
Yes, so we do track the overdose deaths and the overdoses and overdose deaths, yes.
What's that look like?
And so ever since we started this initiative, it has improved greatly. We would like to take credit for that, but as a community altogether, I think that people are really just starting to understand the benefit of it and the stigma reduction. And so like it has definitely decreased. Yeah. The overdose deaths, not overdoses, but overdose deaths.
Okay, thank you. I'll entertain a motion.
I move to approve item 2648.
Second.
Motion and a second. Any further discussion? Hearing none, all in favor, please say aye. Opposed, say nay. Motion carries. Next item on the agenda, 2649, discussion and vote to apply and receive health PHEP grant.
Yes, so we would like to apply and receive, this is the Public Health Emergency Preparedness Grant, which we call the FEP grant. And that's really to help us build our local public health infrastructure in terms of maintaining and growing our preparedness structure. This is a grant that we have received in the past. Last year we did not, but this year, we are really looking at our plans and our community partners and our connections, especially with like in light of all the storms and the things that's going on around us, and just really making sure that we're prepared if that happens in St. Joe County. And we have to activate our ESF 8, which is the Emergency Support Function 8. There are 15 of them in the grand scheme of emergency preparedness, and the health department is responsible for ESF 8. And so we just want to make sure we're prepared. The funding, the $25,000 is going to go to the salary of the person who's really going to be spearheading the tasks and the initiatives associated with that.
And this individual is somebody who already works in the department.
Correct.
So it's just offsetting costs so that we have a little more money in the bank.
Yeah, no new personnel.
That's if it's activated or something it's used, or is it?
No, so it's going to support the salary of the person who's doing the work. So yeah.
Sorry, I'm blank. So this is an Indiana Department of Health grant. Is this a grant that as a county health department, if you apply for it, you'll automatically get it?
Pretty much.
Okay.
It is federal funds that goes to the state. The state asks for all of the counties to opt in. And so you can sign a letter of intent saying that you will. And then when they iron out what the deliverables are going to be, then they give that all to all of the health departments to say, this is what we're going to give you, and this is what we expect in return. And so every year they've been pretty much doing that.
Okay, because some other grants, you ask to apply for them, and then if you get an award, you get asked to receive it. And this, you're asking for both at the same time. So I was wondering if it's because it's.
Yeah, because of the way that they have it laid out for them to be able to get the federal funds, all of the counties have to really say, yes, we're going to receive it, when our process really is different. So,
Okay.
yeah.
Any further questions? If not, I'll entertain a motion.
I make a motion to approve item 2649.
Second.
We have a motion and a second. Any further discussion? Hearing none, all in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Next item on the agenda, 2650, discussion and vote, apply and receive health MRC grant.
Okay, and this grant is the same thing in conjunction of emergency preparedness in tandem with the FEP grant. This is for our Medical Reserve Corps unit. They really want to also make sure that you are have a plan in terms of your volunteers. So by way you communicate, you vet them, you do training and instruction and practice with them. So this $10,000 is to support that infrastructure to make sure you have a strong volunteer group and that they're ready to deploy if needed. And so with that, there's a database, there's trainings, there's communication that needs to be had with them. You need to have a way to vet them, have that all on paper and developing a plan for that. So if somebody is coming to volunteer, you have a process by which you are able to vet them and say, yes, they are credentialed, they're able to do this, we can put them in that category.
It's good.
When we have an active list of that?
So we have had this grant before, so we do have a medical reserve corps established. We do have volunteers established, but we do not have a plan in place in terms of like how we're going to vet them, their credentials, all of the things. I'm actually doing some trainings with them. You could imagine having so many people on so many different schedules, but it's just something to start thinking about and having a plan for. And so that this grant supports that.
Any further discussion? If not, I'll entertain a motion.
I make a motion to approve item 2650.
Second.
We have a motion and a second. Any further discussion? Hearing none. All those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2651, discussion and vote to receive donations from St. Joe County community for use by our school health liaison for the 2026 School Nurse Conference.
Hi, Ashley Hellman, Director of Nursing. So our health liaison, school liaison is fantastic at getting buy-in from our communities, from our community to help make our events better. So she plans great events and then people are excited to step up and support those in the ways that they can. Last month, we talked about the bike rodeo. We've already had 3 bikes donated. We've had Kona Ice is sponsored for the event, all sorts of things that just help to draw more people to the event and make the event itself feel a little more special. We had a school nurse conference 2 years ago. It was an awesome event, very well received. We invited people that were in school health. So it could be an MA, it could be an RN, but we brought them all together, had some great speakers. We want to repeat that this fall. Looking at October, and we have some speakers already on the docket. Hopefully bringing in some community partners to have some tables and maybe some swag for people as well, but would also like to have the opportunity to try to obtain some items via donation for this event as well. And it would be things like food, because we provided that at the last conference, as well as maybe some items to raffle or to give that would help in the school nurse's office.
Is this conference just for school nurses within the county? Do you have to work within the county?
Yes,
Okay.
it's for the schools in St. Joe County.
Okay.
Yes.
Okay, so any school district where a school nurse works, I'm gonna say at least part-time within St. Joe County, because I know
Yes.
we have 3. Gosh, we have 3 school districts that transcend counties, so,
Yes.
okay.
And that would include the parochial and private schools. as well.
Parochial and private, as well as, if there's a homeschool co-op and there is a parent that is providing first aid or what, we include everyone. We try to make the invites inclusive and let people select, because the more information that we can get into people's hands, the better our children's care is when they are in those persons' hands. So we are pretty inviting when we send out that.
Are we charging a fee to attend, or?
We do not charge a
Okay.
fee,
Okay.
no.
So the donations will help cover some of the costs, so it's just the cost of,
Yes.
okay. Where is it going to be held?
I believe at the library
Oh,
That's where we had it
oh, the
last time,
downtown?
the downtown
Oh, okay.
library, yes. And they give us a nice discounted rate to
Mhm.
use their facilities and they're very generous with that as well.
Thank you.
So have you guys thought about offering like CEUs or anything like that through the conference? It's just an application. You might get a lot more.
Yes, that
People-
was a suggestion from the last conference, actually, one of the feedback, some of the feedback that we received. So that is something that we have taken into consideration. And yes, I think as we finish put the finishing touches on the conference, then that's where we'll add some of those things.
And so in this particular grant request, you're not requesting that to accept monetary donations. You're simply requesting the food, like somebody is going to pay for the food,
Yes,
swag,
yes,
uh,
a raffle, yeah,
raffle. Okay.
yes, yeah.
Okay. Okay.
Yes.
And people are lined up who are hopefully
Well,
going to donate?
Ms. Hope is on the call here. Hope is very well connected and typically when she asks, people are very happy to support. So I don't know that she has, I believe she has not asked people yet because we want to make sure that it's approved. We don't want to
Okay.
get, promises of anything and then have to turn it down.
Mhm.
But she does a really great job.
Okay.
Is there a problem with doing monetary donations? Does that make it?
I mean, it's just not, I didn't see it being asked, so I just
Yeah,
wanted to be.
it's donations in kind
Yeah.
to keep things.
Okay.
That's another.
Well, maybe we
great
could-
idea.
Maybe next year we can.
Start earlier.
And
Yeah.
if you continue to do it every year and just make it like a standing thing that.
That's
So-
a great idea.
So basically, instead of getting people pay money to cover food, you find somebody's generous enough to place an order with
Yeah.
Panera and just send it to the library at that time.
Yeah.
Yes, exactly. Yes.
Thank you. I assume legally we're all covered with this. Oh, yep, all right. I'll entertain a motion if so inclined.
I make a motion to approve item 2651.
I'll second. You can second. Second. Nurse.
All right, we have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you. Next section, old business. Item 2642, discussion and vote on wastewater advisory board appointments. Representing municipal water on our board is recommended Tim Brill.
Tim Brill just recently retired after a 30-year career with the city of Mishawaka in their wastewater division. He was their manager and he wanted to stay active in the community and this is something he would like to do.
Sounds great. Any
Is there only one? I thought there was a second person.
others?
That's the only one that wasn't filled that we didn't, the Board of Health has their number that they need to fill and that was the only one that we had that wasn't filled. Oh, that's the different water, that's the Water Advisory Board.
Any questions or comments, or I'll entertain a motion?
Make a motion to approve item 2642.
Can I have?
We have a
one
motion,
vote?
we have
I
a motion on the floor.
Oh.
We have a motion. Do we have a second on the motion?
Well, I'll second. And
All right.
then-
Any further discussion?
I just have a quick question or a point about it. So I just want us to be careful with the fact that someone who is, I know he's very knowledgeable about wastewater, but this is for the whole county, correct?
Hmm.
So I don't know about all the other board members. I don't want it to be that we're leaning only toward municipal wastewater and expansion of our sewer and versus a septic. I don't want the septics to get lost in the shuffle. Do you know what I mean? I know we've had talk in the county about expanding sewer versus and getting rid of a lot of septic systems. And I've had some people contact me about worry of that. Like they don't want to necessarily have a board made up of people that are very sewer leaning. So that's my only,
The qualifications of the board members is set by the ordinance. And they purposefully, the county council put on there water, wastewater system representative. So with regard to sewage disposal, if there's public wells in the area, they wanted that voice to be represented as part of considering policies for on-site wastewater disposal.
and that's what you're intending him to do, both, you're saying.
He represents that position
Yeah.
that was set up by the county council.
Afterwards, I'll show you the St. Joe County Council nominates people to be on it. The commissioners nominate people to be on it, and then we do too. So I can show you the different,
Okay. You don't.
Professions.
I'm not.
Yeah.
I wanna make sure. We're well.
yeah, they have Realtor, they have septic system installation industry, builder developer, certified soil scientist, septic system industry rep, inspector / installer. And then we have the hydrologist, biologist, health scientist, earth scientist, a municipal water, wastewater system employee, and an at-large person.
So he has to fill that spot. Okay, got it.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, 2643, discussion and vote Water Resources Advisory Board appointment in the chemist position, Dr. Grace Muna, and the hazardous substance management experience position, Grant Pooley.
Cool, yes.
Cool.
Dr. Muna has a long tenure at IUSB in the chemistry department. She's been there for over 20 years, and one of her interests is water chemistry. We had asked a few other chemists and they declined, but she was very pleasant and very gracious and agreed to do this, said she's interested in it. Grant Poole was actually recommended indirectly from IDEM. We had asked Northern Indiana IDEM rep about being on the board, and he was not able to do it, but he recommended this group of people that does environmental protection. And actually, Grant is from Cass County, and so Cass County, Michigan. And so he has a large background in, he's a hydrologist by training, and he's got his master's degree, and he likes to fish.
And we checked, or you checked, and the fact that he's a Michigan resident does not preclude him from being on.
It's not a problem. They do not have to live in St. Joseph County.
We wanted to make sure we said that.
Yeah.
It's on the record.
Thank you. Any other questions or comments?
So she's fulfilling the specific
Chemist.
chemist position.
Right.
And he's filling what position?
Hazardous waste,
Okay.
solid waste, right?
Hazardous.
Substance management. Yeah. No other questions? I'll entertain a motion.
I make a motion to approve item 2643.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next section is public comment. If anyone wants to speak, please sign up over on the clipboard. Jenny, do we have anybody? Nobody today. All right, thank you. Next item on a section on the agenda, time and place of our next regular meeting will be September 16th, 2026, 4:30, fourth floor chamber, council chamber right here. Any issues with that? Everybody good for that? All right. With that, we are adjourned. Thank you very much, everybody.
Thank you.